This is In the Loop. I'm Christian Bryant. We're kicking off this show talking about phones. Well, a phone number more specifically. The first call to 911 was placed in February of 1968, and ever since, it's been the number we call for any and all emergencies. 3 simple digits to get help when you need it. Simple enough, right? Well, not exactly. Responses vary on the situation. Sometimes police are needed at the scene. Other times it's EMS or firefighters. But many mental health advocates have argued there are some emergencies that might need another kind of response. In recent years, there have been several cases where someone suffering a mental health crisis was shot and killed by police.
When things get to the point where somebody's calling 911, you may or may not be able to prevent that from becoming a police matter. But I guarantee you that almost every one of those issues, there were opportunities earlier, maybe months earlier, maybe just a few weeks earlier, where that could have been handled as a medical or a social services or treatment issue rather than as a 911 call. And that is where people need to invest.
Come July, a new 3-digit number will be available, 988, set up by the Substance Abuse and Mental Health Services Administration. The hope is that this number will connect people with a response to mental health-related emergencies. The new number will replace the National Suicide Prevention Hotline, which is currently a 10-digit number. It's worth noting that even after July, you'll still be able to use the current Lifeline number, but all calls will be routed to the same place. When you call 988, you'll be routed to trained counselors who will listen, provide support, and connect people with resources if necessary. Lisa Daly is the executive director of the mental health nonprofit Treatment Advocacy Center. She explains that the new line will be available for emergencies, but also address situations proactively before things escalate.
Like if you're talking about heart health, we know that before you get to the heart attack point, there's a whole bunch of, you're a senior physician, you're doing screenings, you have opportunities to intervene at the non-emergency level. Hopefully that prevents you from ever having a heart attack. If you do have a heart attack, we know what happens. You go to the hospital and then there's this follow-up care that happens. We don't have that for mental health conditions, and we don't have that for behavioral health a lot of the times.
This number is becoming accessible as health experts across the country say we're already in a mental health crisis. 1 in 5 adults live with a mental illness, according to the National Institute for Mental Illness. Teens are also being impacted. An estimated 49.5% of adolescents have a mental disorder. Suicides in the U.S. have also increased the last 2 decades, with the pandemic exacerbating things. Advocates say this new number will reduce interventions with armed officers and decrease the reliance on emergency rooms.
So the idea would be that we're expanding the scope of what was just the suicide hotline to also encompass behavioral health crisis and substance use crisis and the kinds of things that we want to decriminalize. So we're basically providing an alternative to 911 that is really more set up to have people respond who are not law enforcement unless that's absolutely necessary.
This was all put in motion back in 2019 when Congress passed the National Suicide Hotline Designation Act. The plan is for this new hotline to build onto the original Lifeline that was established in 2005. According to a report from Substance Abuse and Mental Health Services, there's a network of over 180 independently operated and funded local call centers, including 38 chat and text centers, 3 Spanish language centers, and 9 national backup centers. But funding is a major concern. Most of these centers receive minimal direct federal funding to support their operations, typically a yearly stipend of anywhere from $2,500 to $5,000. They predominantly rely on local, state, and private funding as well as volunteers. The bill does allow state lawmakers to raise money for call centers the same way they do for 911, which is a monthly fee on phone bills. According to the New York Times, the fees collect an estimated $3 billion a year for 911 services. Currently, only 4 states have authorized a phone bill charge for 988. On top of funding concerns, there's also a worry that funneling all these resources to 988 might lead to the line being overwhelmed and more people not being able to get through.
We want to make sure that people understand that this isn't going to be like flipping a switch where 988 suddenly goes live and it's ready to go. Everybody's going to need to stay involved and active and advocate to make sure that this turns into what it can turn into. It's going to, we won't be done in July. We will be starting in July. But we really do have the potential, because people are paying attention to this, finally, we have the option to finally kind of build a system that can do what it should do.
While this is mandated on a federal level, some states and cities already have their own existing crisis line. Newsy correspondent Amber Strong took a look at comprehensive efforts to decriminalize mental illness and the impacts they are having on communities across the country.
Hands up! Don't shoot! Hands up!
In 2020, the country was in the midst of a reckoning between officers and those they serve.
You're gonna stay down. You're gonna stay down. All right, take this off my plate.
No, I got it.
Deaths of people like Daniel Prude, who was in the midst of a mental health crisis, shined a light on police abuse and gaps in training. When police officers are expected to be ready, no matter the situation.
People are in crisis, and I didn't know how to handle them.
A new idea is taking hold across the country. The thinking is that officers shouldn't be the first on the scene. And in some cases, when it comes to mental illness, shouldn't be on the scene at all.
She's suicidal, doesn't want to go voluntarily. Do you have any information on her?
Officer Adam Beard and Andrea Hess are part of a co-responder unit in Prince William County, Virginia. Here, some officers are paired with mental health clinicians.
We want them to be as comfortable in the situation as we can possibly make them while still having safety in mind.
87% of the calls that they go on do not end in custody.
Heather Baxter oversees the region's implementation of a statewide initiative called Marcus Alert.
It's not just a police officer there to keep the safety under control, it's also the mental health clinician there to make sure that you get what it is that you need.
Named after Marcus David Peters, a biology teacher killed by Richmond police during what his family calls a mental health crisis, Marcus Alert goes beyond co-responders. There's the regional call center. When a call comes into dispatch, 911 operators decide the severity of the mental health emergency. Level 1 and 2 calls are sent to a regional crisis call center, who conduct additional assessments and offer physical and verbal support. No cops involved. For levels 3 or 4 calls,
if police are needed, our co-responder team would have a clinician there with them who can handle that.
You can sign up using the Smart 911 app.
There's also the county's usage of Smart 911, a nationwide app that allows users to create profiles, letting dispatch know of any medical history in the home.
You don't always remember everything that you need to tell the person on the phone. You're in crisis when you're calling.
1 in 4 fatal police shootings involve people with untreated severe mental illness, according to the Treatment Advocacy Center. And in 44 states, jails or prisons hold more mentally ill people than state psychiatric hospitals. One reason is the process. Having an officer bring a person to a healthcare facility is lengthy and requires admission from said facility.
The officers are physically there with them. They're watching them go through this. Some people are handcuffed to gurneys in hospitals, and we've had that up to 14 days.
Officers are sitting with people in the emergency room who need help, who need treatment, but there's a lack of bed space and nowhere for them to go.
Lisa Daly with the Treatment Advocacy Center says this can result in the one thing advocates hope to avoid.
You can kind of see how, from the perspective of law enforcement, it becomes very appealing to arrest that person instead of bringing them for a mental health evaluation, because you bring them to the jail, you drop them off, you're back out on the street.
We're tasked with this very hard decision of there's nowhere for them to go, but we can't let them go home. And it for anyone who got into this business because you wanted to help people, this is a very frustrating time.
Daly says the national bed shortage is one of the systemic mental health issues caused by a lack of funding.
This population that has been inappropriately criminalized, you can't actually push it back into the behavioral health system until you have a system.
Ideally, that would be getting people help before a crisis. Baxter says that's the goal.
So the hope is it gets stopped at dispatch and never even goes out to police if that's the thing. And then also giving police a tool other than putting someone in their car and driving them to a hospital.
Amber Strong, Newsy in Prince William County, Virginia.